Hello and welcome. Let's talk about haemorrhoidectomy. Indications of haemorrhoidectomy: third and fourth degree hemorrhoids, second degree hemorrhoids that have not been cured by non-operative treatments, fibrosed hemorrhoids, and internal external hemorrhoids when the external hemorrhoid is well defined. Preparation for haemorrhoidectomy: nothing by mouth, stool softener in the days of before surgery, enema simplex to empty the rectum, perianal area to be cleaned and shaved, preoperative sedative, and opening of an IV channel. Post-operative management for haemorrhoidectomy: the patient is discharged from hospital 1 to 2 days of the operation. The patient is instructed to take 2 warm baths each day, and the patient is given a bulk laxative to take twice daily together with appropriate analgesia. 5-day course of orometronidazole may be given to reduce pain, and dry dressing should be given. Sterile sanitary towel is being ideally used, and the patient should be seen again after 3 to 4 weeks after discharge, and a rectal examination is performed. Complications of haemorrhoidectomy: early pain, acute retention of urine, reactionary hemorrhage may be seen. In late cases, secondary hemorrhage, anal stricture, anal fissure, and incontinence may be seen. Management of retention of urine after haemorrhoidectomy: it is usually corrected spontaneously, but if there is delay in spontaneous correction, then it should be relieved by catheterization. End of the topic.